obesity is part of my family. We're all overweight. So I've been overweight my entire life. It really started becoming a problem around 18, 19 years old though. My name is Courtney Howe and I had gastric bypass. Weight became a problem for me pretty much my whole life. I've always been a heavier person. I did gymnastics when I was younger, so I was skinnier then, but that was 8, 9 years old. Once I quit gymnastics, then I did start gaining weight. I have tried just about every fad diet out there. I have done it all. I've done the Weight Watchers, pills, shakes, wraps, all of that kind of stuff, keto diet, everything that you can think of. And my father actually had gastric bypass in October of 2011. And he lost a lot of weight, and I kind of thought about it then. I had another son, and the more I thought about it, I had tried new things, more things, and still wasn't losing weight, and so I went the bariatric route and started doing a lot of research on my own. The procedure that I had was gastric bypass. Before I had the surgery, I really loved food and would eat quite a bit and never really felt that full feeling. Since having my surgery, I know what full is again. Unfortunately, I had stretched my stomach out so much that I never really got full. Having the surgery has brought me back to when I was a kid, to where I did, before I had stretched out my stomach so much. And so now I feel the full feeling and know when to stop. Surgery is definitely not the easy way out. You learn so much about yourself and your body all over again. Surgery is just a tool. The highest recorded weight that I have was 283 pounds. And I've lost a total of 105 pounds. I kind of am around 163, 165 is what I stay around right now. So when I had my surgery, the day of surgery, I believe I was 243. Before surgery, I had high blood pressure. I was pre-diabetic, minor sleep apnea. I did not use a CPAP for that, but I had a sleep study beforehand. Within a month of my surgery, I was completely off of both my blood pressure medications and monitoring any kind of glucose levels. I have no more high blood pressure. In fact, more often than not now, I run on more of the lower side. I have no blood sugar issues, anything like that. Other than that, I had no other health problems besides just the obesity. My experience with Dr. Aryaie has been nothing but great from the very beginning. I had heard about him through friends, but I had never met him. But for my very first visit, he has made me feel comfortable. I've seen him in places out in public, and he has actually stopped and talked to me, remembers my name. I've dealt with other physicians before that a month after a surgery, they don't know who I am. And the first time I saw him, immediately he knew who I was. He talked to me. He's just a great guy with a big heart and truly cares about his patients. The day of surgery, obviously I was extremely nervous, but at the same time I wasn't nervous. I knew I was in good hands, and I knew that this was going to be a life-changing surgery for me. So I was probably more excited than anything. I had a mid-afternoon surgery, so I had been on a 2-week all-liquid diet, so I was hungry. But other than that, it was great. And Dr. Aryaie came in and saw me, made me feel comfortable. I knew I was in safe hands. I had been told before that they do put a lot of gas into your stomach to kind of expand everything. So I had been forewarned to walk as much as I could, and Dr. Aryaie actually had me walking in the post-anesthesia care unit right after my surgery. I think that helped a lot. He obviously knows what he's doing and knows what's going to make us feel better quicker. I did not want to walk right afterwards, but I did, and I think it really did help my care. The first night was not bad. I was expecting to be in a lot of pain, but I really wasn't. It was more of just the gas pains, but the more you walked, the more you moved around, the better that felt. Definitely recommend moving around a lot, and the quicker you get up and try to maybe not get back to normal, because this is a whole new normal for you, But the quicker that you move around, the better you're going to feel. I took 3 weeks off of work, and I think I could have gone back after a week, honestly. The recovery is really pretty easy. It's the mind that you have to recover the most. I have a 5-year-old. I can go and chase him, and we actually got season tickets to an amusement park this summer. We go because I wouldn't go before. I was afraid I wouldn't fit on the rides. Every time we would go somewhere, I was terrified that they would tell me I was too heavy to ride it, or would be a danger to myself or somebody else because it wouldn't click, or, we went, I don't know how many times this year. I was able to go do that kind of stuff. We went to water parks, we went to amusement parks. I'm a gym rat now. I love going to the gym and working out. I have a personal trainer. I never thought that I would be the type to want to go do that stuff, but I'm going to be around for my family now. So that's worth it in itself. Something I can do now that I couldn't do before is play with my son more. I work a full-time job and on my feet 8 hours a day, going back and forth. I would be exhausted when I came home. And unfortunately, playing with him was the last thing I wanted to do. I wanted to do it, but it was the last thing that my body could handle. After fixing supper and getting everything ready for everybody, mom's always the last one taken care of. So after getting the rest of the family taken care of, he wanted that mommy time, and I was exhausted and couldn't do it. Now I can get down there and play with him after going to the gym. Sometimes I get asked if I would do this surgery again, and my answer is absolutely yes. My only regret is that I hadn't done it earlier. I've thought about it for years and never thought I was mentally strong enough to be able to do it, or that it was something I could afford, honestly. I wish that I had done it years ago and would have been able to enjoy my life more. I've been given a life all over again. I would recommend Dr. Aryaie to anybody that is considering any kind of bariatric surgery. He sits down with you, he talks to you, he tells you about the different options that he offers. He tells you what he thinks you need personally, but he also gives you that option to decide for yourself. He's obviously the one that has the experience and knows what's best for you, but he lets you decide. And then when you tell him what your decision is, he asks you to explain why that's your decision. And as long as you have a good reason and he knows that you're doing everything for the right reasons, he's going to take care of you, and you don't have to worry with him. You're going to get great care no matter what surgery you have. At the same time, he's going to be on you and making sure that you're doing what you're supposed to do. And that's what you need. I mean, we didn't get heavy because we're good at following directions. Obviously, if we could have followed our own plan, we wouldn't have been in this position. He's got a plan. He knows what needs to be done, and he's going to make sure that you succeed. He's going to do everything he can in his power to make sure that you succeed. Always there for you.